Since switching to a low-carb diet, my blood sugar levels have stabilized and are closer to non-diabetic numbers than they ever have been since diagnosis. So, to avoid diabetic complications like kidney disease and heart disease, it is necessary to keep an A1C at 5% or lower. Is it possible? If you go low carb, it is. It is the most important variable to a diabetic in keeping blood glucose levels as normal as possible while reducing the varying blood glucose as well. Although something else happened after I changed my diet. My LDL particle count went sky high, alarming my doctors. My LDL-P has been greater than 2,000 ever since, with in the LDL-C around 300. On a high-carb diet before the switch, my LDL-C was 68, and I have no reason to believe that I was discordant. So, as Peter Attia says in the next slide, an LDL-P of over 2,000 is the 99th percentile and very indicative of risk for heart disease. Particle production versus particle clearance. If free T3 levels are very low, the clearance of LDL particles becomes diminished, resulting in an accumulation of LDL particles in the blood. So what should I do about it? According to Chris Masterjohn, I should increase my carbs, thus increasing the free T3 and enhancing my particle clearance. But in doing so, I would relinquish my blood sugar control, and that is something that I won't sacrifice.
The hypothyroidism, especially defects in the conversion of T4 to T3, which we talk about in the thyroid video, are so common amongst diabetics. Almost all of my diabetics have low free T3 before I see them. It should be a routine thing to check in diabetics.
Well, thank you for pointing that out, the important relationship between thyroid hormone and cholesterol, because it's one that's not frequently mentioned, yet is a big issue. And frequently, before the introduction of statin drugs, one of the common treatments for high cholesterol was routinely the use of thyroid hormone. And especially, I mean, it was clinically, that was even before my time, way before the 80s.
The most effective trial I've ever seen in something that reduced the risk of heart disease pharmacologically was a trial that William Kuntz published in the 1940s, where he took people who had low metabolic rates and gave them thyroid extract, and he almost obliterated the risk of heart disease, especially in the younger people, way more effective than statins or any of the other drugs that are given now.
My endo said it was unrelated, but to his credit, he was willing to give it a shot.
However, liothyronine per se is very rapid acting and finishes working in about 8 hours. So to get a steady level all day long, you have to take it every 8 hours.
Even though my free T3 did not get to normal levels, there should have been a modest reduction in particle count. So, back to the drawing board.